So what you'll find when you come to the simulation laboratory at residential school or during internal classes, that you will have the mannequin set up with a suture line or a staple line, as you can see here. However, that is to simulate what it actually looks like. We are going to use a padded device that has sutures put in and staples put in, and that enables us to actually practice lots and lots of times, and our tech staff just produce these over and over again and saves the wound for the simulation.
You can use this one to do the dressing part and the
Absolutely.
cleaning first to practice that, and then have
That's
a go
exactly
at this one to
right.
take the sutures out,
Yep.
staples out.
So cleaning the suture line and actually removing the staples with the padded device. And you'll also find that we'll have, on the other side? No. Usually on the other side we'll have the stitches.
Okay.
Stitches on one side and the staples on the other. Okay, Manny, we're now just going to set up the dressing pack and take these staples out. Are you happy with that?
Yeah, that sounds fine.
Excellent. And Evan, because I have sterile gloves, I can actually touch all of this. Whereas when I don't have sterile gloves, I have to use the aseptic technique.
Yep, and it becomes important not to touch your perimeter that you talked about previously as well.
Exactly, need to maintain that, 2.5 centimetre perimeter. That's right. So what I have here are some swabs that I can put them all in. Because I have sterile gloves on, I can use my fingers. It's really important to set up your space so you can find everything.
I think it's important as well when you're setting up your pieces of gauze and things that you're keeping track of how many you have, so that you make sure that you've disposed of the right amount.
Absolutely.
You're not going to leave them where you don't expect them in a wound or something.
Exactly. Now I like the field extension. Do you use it?
Not very often, I have to be honest.
Yeah? Why not?
I think because it's not waterproof and it tends to get damaged easily, that I just tend to
Yeah.
be more careful when I accept that I'm going to make a bit of a mess. It's important to note that you've got a
Yes.
absorbent pad, or a bluey usually referred to.
Yep.
That's not sterile, so this is not part of the sterile
Absolutely.
field.
That's
and it's
right.
different, but this is waterproof, so that would protect the bedding.
Yep.
And would collect blood and things if you have a bit of ooze and stuff.
Yep.
But it's not the sterile part that you're about to set up.
That's right. I like the sterile field, and I always use the sterile extension field. And you will, Evan's quite right, you will find people won't use it in practice. It doesn't mean they're doing it incorrectly, it just means they're choosing a different way of doing it. I like to extend my sterile field, and I actually like to put the staples on the sterile field as I remove them before I dispose of them in the sharps bin. As you can see, I've got my fingers nicely protected inside that sterile field, and that reduces the risk of contamination, cross-contamination onto my gloves. So now I'm going to just clean that suture line, and I'm selecting my patient forceps, the yellow forceps, picking up my swab, transferring to my patient forceps, and one pass and throw away. Pick up my clean swab, I'm transferring, and you'll note that I'm not transferring over the top of my sterile field.
It's also important to note, you might do this again, that you're not touching the tips of your forceps. I'm not going to touch them either, but
Yep.
you've got your patient forceps and your sterile forceps, and those tips aren't touching each other.
That's correct.
They're both grabbing the same piece of material, but they never knock against each other
That's
because
exactly
one's
right.
clean and the other one's dirty.
That's exactly right. Because I'm actually not quite finished, I was going to dry that off. I'm now going to dispose of my patient forceps. Now, this is called a staple removal. And as you can see, there are two arms down the bottom and there's a top arm. The idea is to lock the staples underneath the bottom arm and then squeeze down. The squeezing down bends the staple in the centre, allowing the arms to come apart. Position the staple remover underneath the staples, push down, arms come up, a twist to the left, twist to the right, and it's removed. When we go to remove our gloves, it's really important that we remove them in a way that we're not spreading bugs around the room or on ourselves, and it's a bit of a trick to it, so this will take some practice. What we do is we pinch the cuff of our gloves, and with a twist, they're removed. And what you can see is that all the dirty or the debris is on the inside of the glove. So that's a really nice way to remove your gloves, and you'll need to practice that.